Hello, I'm Wisland Jill. In our daily life, we are blessed with green spaces. It is very beneficial to our environment. It helps keep our equilibrium and our health. Regardless of our race, gender, income, neighborhood, or other social condition, communities that have green spaces are stronger, healthier, and give a fair opportunity to everyone to live a long and healthy life. Green spaces provide the necessary places and opportunities for physical activity. Exercise improves cognitive function, learning, and memory. Children who exercise and play outdoors are healthier, perform better academically, behave better, and have a higher self esteem than those who do not. Green space has a positive impact on health and health related quality of life among adults that help alleviate symptoms of Alzheimer's, dementia, stress, anxiety, depression, and improve cognitive function in those recently diagnosed with breast cancer. Researchers have determined that annual rates of up to 15 different major diseases were significantly lower among those living near green spaces. Green spaces include parks, community gardens, cemeteries, schoolyards, playgrounds, public sitting areas, public plazas, and vacant lots. Several studies in various healthcare settings have shown a link between nature and healing. Nature helps restore the mind from the mental fatigue, contributing to improved work performance and satisfaction. Having quality landscaping and vegetation in and around the places where people work and study is a good investment. Both visual access and being with green space helps to restore the mind's ability to focus. Green spaces provide health benefits across all social and cultural boundaries. They provide a place for social interaction where people gather to have picnics and play. They go for a walk, breathe fresh air, play sports, and exercise. Financially, green spaces offer free or inexpensive way to reduce stress, have fun, and improve health. For our environment, green spaces reduce our carbon footprint and improve air, soil, and water quality. Spiritually, communing with nature provide opportunities to connect with your spirituality. Engaging in outdoor activities can be mentally and intellectually stimulating and relaxing. Emotionally, whether it's stress reduction, pure fun, nostalgia, or gratitude, being in nature opens door to our inner lives. Exercise, stress reduction, interaction, and playtime are always beneficial to our well-being and contribute to our health. Green spaces are good for cities. Community members have a greater chance to interact, and crime rates most likely will be lower in community with green spaces. According to Ashley Kohler, having green spaces boosts a community's economic development. Overall, green spaces contribute to health promotion, and as nurses, we should advocate for green spaces in our community.
My name is Haifa Karam. Over the years, my family and I have enjoyed the physical, mental, and spiritual benefits of open green spaces. Studies have shown that health inequality between rich and poor people are much lower in areas that have lots of parks, forests, and playing fields. According to research, having green spaces available across all social boundaries can move us closer to health equity. Inequality in health outcomes are primarily influenced by unequal access to conditions and resources necessary for healthy living. The Land and Water Conservation Fund was passed in 1964 under President Eisenhower. It has been the principal funding source for federal and state through matching funds for land acquisition for conservation and recreation purposes. The Bureau of Land Management, the Fish and Wildlife Service, the National Park Service, and the Forest Service all receive funds from the Land and Water Conservation Fund. In urban areas on the local level, the planning of green spaces is dependent on city government as well as city planning and zoning codes. The availability of green spaces differs greatly between towns. Where I live, city planners made recreational areas a priority. On any given day, there are people of all ethnicities and backgrounds enjoying the outdoors. Unfortunately, many neighborhoods and cities are still lacking open, safe green spaces for public use. As nurses, we have a responsibility to promote green spaces. In doing so, we are working toward improving the health of all social groups, regardless of their ethnic backgrounds, socioeconomic status, and geographic location. Advocating in this case is an expression of caring about others' well-being. It is contributing to the creation of a healing environment that is equally accessible to all.
Hello, my name is Venice Joseph. Green spaces provide humanity with overwhelming opportunities that encompass good health physically, mentally, and spiritually. Many people prefer the outdoor green spaces for physical activities, whether walking, jogging, or playing sports. Individuals are more willing to walk, bike, and run in green space areas to achieve weight loss, as that improves and sustains quality of life. Childhood obesity has become a great concern over the past few years as the prevalence continued to climb due to lack of physical activities. Green spaces provide children with the perfect environment to perform physical activities. Lack of physical activity can lead to debilitating life by increasing the risk of heart diseases. Nurses need to educate people about the life-changing benefits of green spaces as it will reduce the suffering of many people. Green spaces provide people with gentle calming areas to release stress, stabilize their mental being, and uplift their spirituality. A great number of people utilize green spaces to pray or perform spiritual activities such as meditation, small spiritual group gatherings, and church services. Many people slowly walk through green spaces as they gaze at beautiful trees, flowers, and the environment as a way of releasing mental stress. According to Servicen, open space can aid in mental restoration by providing a sense of fascination as well as a greater extent, separating users from distraction, reducing negative emotions, holding a person's attention, and blocking stressful thoughts. Green spaces provide a healing environment for everyone in any stage of life. The benefits of green spaces encompass health and healing in such a way that green spaces need to be made known to everyone. Nurses are in great position to educate the public about the benefits of green spaces and become actively involved in promoting these health advantages. Nurses can organize community gardens as a way to motivate people in staying connected to continue gaining the benefits of green spaces. Nurses can physically organize group walks to green spaces, which will assist in motivating people to become actively involved as it supports their health. By educating the public about the health benefits of green spaces and building partnerships with communities, representatives of government, and the public and private sectors, we can effect a change that will influence many to better health. As nurses, we are privileged to be an inspiration to others by helping them to live healthy lives through advocating and promoting green spaces.